Just a stone's throw away from Nancy's home in Padea district lives a 35-year-old man. He has been giving her a lecherous look for a couple of years. Nancy is aged 14. Her life for the past 5 years has been characterized by falling in fires after seizures, nodding her head, having saliva flow from her mouth uncontrollably, refusing food, lip biting, delirious, and quitting school because she has been having mental challenges on occasion. She has nodding syndrome, a puzzling disease for medical experts since it was first documented in Tanzania in 1962.
Cha can be bala where we are teacher mara no ring She don't mean cha wing na bit a guacone, Timo gum wouldn't pick guacal wet guinea benedon naya. Pen unable to take a guaco and Paramartin dear matericum.
To desire to have sexual relations with the people who cannot, who are weak, who cannot defend themselves.
Yeah, so this girl who has nodding disease and is mentally disturbed, she also doesn't have judgment.
She doesn't have the judgment, and she is a child.
Some girls exhibiting the same characteristics as Nancy have not been as lucky. They've been sexually abused. The outcome for many women of reproductive age is often pregnancy, regardless of whether or not they have nodding syndrome. Pregnancy has its share of mood swings.
The pregnancy may worsen their mental health condition. But in certain instances, we have seen women who are pregnant and their mental health condition is not bad because they are happy with their pregnancy. It depends on how they react to their pregnancy.
With pregnancy, nodding syndrome sufferers face numerous problems.
There are some medicines which are too strong and which could affect their baby, which would not want a pregnant woman to take. So it is very important that a person who has mental illness and is pregnant should see a senior mental health professional, a psychiatrist or a psychiatric clinical officer who has very good knowledge of these medicines and therefore put them on medicines which are less harmful to their baby.
How do you educate? First of all, their mental status is a bit subnormal. So these messages will give mothers in antenatal, do this, have good feeding, go for good hygiene. She will not understand.
What is unfortunate for these pregnant girls with nodding disease is that they do not have health centers nearby to access such antenatal care. Therefore, required antenatal visits will not be fulfilled. The psychological effects of nodding disease are so adverse that they not only affect the mother, but they go as far as affecting the baby.
These are people who will have more problems and you'll end up doing a cesarean section to save the baby. Because you'll not cooperate when it comes to real pushing the baby, you may end up having problems there and you get a fresh silly bath.
What if a seizure happens?
Yes, and this is the main problem. Now we can handle that medically. We have drugs to control the seizures. When you are now really convulsing, you are unconscious, and there's a really impaired blood supply in the brain. It can also affect actually blood supply in the placenta. Though we cannot say it's properly documented right now, but this is a hypothesis that can happen.
The convulsions may also cause the mother to fall on her abdomen.
Again, you get another emergency which we call APH, which you could do because the placenta is separated. This is severe bleeding again. The mother can now die even with the baby all. Maybe she's on a delivery bed, which are high. She has convulsed there, she again falls down. It's a special way of handling them now.
And all this is a scenario in hospitals. But imagine the girls delivering from their homes with no medical assistance, as is the case here. When a girl or woman with nodding syndrome survives all this and gives birth to a healthy baby, the danger does not stop there for the baby and the mother. For a breastfeeding mother like this one, it is obvious what will happen to this baby if she got convulsions. If the mother does not fall in fire or in a well, it will be the baby to face the repercussions of the seizure. But should girls be denied a chance of becoming mothers because they have a disease for which no cure is known and no definite cause has been identified? The answer is simple. As long as they're out of their state of mind like any other patient with mental illness, they should be given protection. However, this is not the case from the villages they hail. No one really cares. The disease has defeated them. Only a cure for nodding disease will save these girls. Florence Naliba, NTV.
Yes.